Hello friends, welcome back to your own YouTube channel Ask Your Gynecologist. I am Dr. Sonal Parihar. As usual, I have come back with a new video for you all depending upon what all you suggest and depending upon the topic that I think is very important for you. So this time we are going to discuss about meconium aspiration syndrome. Now many people ask me what is meconium. Many messages I get through YouTube, through Facebook, and I also get people on DocWise app and they consult me about meconium because they don't know what is meconium. Suddenly the doctor told them that the baby is not in a good condition and they had to go for cesarean and they're confused, or probably they understood at that time but they did not it did not register in their mind, and they kind of forget within 2-3 years. They forget that why this happened, and then they start thinking, oh, was this a prank or was this something wrong? Why did the doctor say that? Well, okay, so just to clear all these things, I have made a video on this. Now before I start with the topic, let me just thank you all for the tremendous response you have given to the channel. It has grown very well in the last 10 months, and people who want to contact me directly, there are 3 ways to contact me. First is my hospital's address. You can come to the address if possible. You can come down to Jodhpur, Rajasthan, and that is the best way to consult a doctor so that I can examine you personally. The other thing is, if you want to consult and if you just want to ask a few questions, now I go live every alternate day, you know that, and I answer the question depending upon what language you're using. If you're using Hindi, I talk in Hindi. If you're using English, I talk in English. So this is the way to basically get your questions answered. I generally do not answer personal questions on YouTube because it is not possible. When you are talking to public, it has to be a general question. When it is a very personal question, you either use DocWise app. That is another way to contact me. DocWise app is a mobile application. You can download it from the mobile Play Store, and then you put my PIN. This is my PIN. Then you are connected with me, and if you want to call me, there is no way to call me directly, but I have given you my secretary's number. You can take an appointment with her. She can always direct your calls through the hospital to me, or you can come down to the hospital for an appointment, right? So these are the few ways that you can use to contact me. The other thing is, I was telling about the live session. In the live session, if at all you want a question to be answered there and then, you don't want to wait for the next session, then the other way is to use super chat. Now super chat, if you just click on it, you can type your question there. YouTube will ask you for some money using your card, and then you can get the answer there and then because it flashes on the screen. So I just answer it on the same session, right? Apart from this, I have got other portals like my Facebook pages, Instagram, Twitter. You can follow me there, but please do not type your questions there because I just see YouTube. It is very difficult for me to gather questions from everywhere, and do not email me the questions. Please do not do that. Okay, so coming back to the topic, meconium. Now every parent wants that their child should be healthy, that the pregnancy 9 months should be uneventful, and if possible they should have a normal delivery. Nobody wants cesarean, nobody wants an unhealthy baby, but then things are not always in our hands. Many times things are not in the hands of the doctors as well. So it just depends what is there in the destiny. I am very sorry for the people who have suffered from meconium aspiration syndrome and the babies have died. It can be very serious. Now if you look at the incidence, it is just probably 10% of all pregnancies. 10% of all pregnancies will have meconium, will have their baby passing meconium inside the uterus, but only 1% will actually have this syndrome, meconium aspiration syndrome. Now what is meconium and what is meconium aspiration syndrome? Meconium is the stool. It is the potty, the stool that the fetus, the baby, passes within the womb, within the uterus. Now why is it called meconium? Because the color is greenish. It is darkish green. It is not like the normal brown stool which the normally adults and even the babies who are 7 days or 8 days, 10 days old, they start passing. So when the baby is inside the uterus, it is drinking the amniotic fluid, and within the amniotic fluid there is lanugo. Lanugo is the fine hair which the baby has on its body. It has vernix caseosa, which is the mucoid, the mucus like sticky material, whitish material which kind of sticks on the baby's body. You must have seen the newborn babies have to be cleaned properly with oil because they've got the sticky material that is called vernix. Then this fluid also has some bile pigments. It also has the epithelial cells which the baby sheds, the cells of the body of the baby. So it is a mixture of all these things. So when this goes inside the baby's mouth, when the baby drinks this is the color of the stool that passes. The meconium is darkish green in color. Now meconium aspiration. Meconium aspiration means the meconium has actually passed inside the trachea, that is the breathing tube, that is the trachea, and then the bronchi and the alveoli. So basically aspiration is what? When you drink something and suddenly it goes inside your windpipe, that is called aspiration. Now why is it serious and why does this happen? Which babies pass it? Well, meconium, as I said, is the stool. Now generally speaking, the baby should not pass stool inside the womb. Right? Now when you strangulate somebody, when you must have seen in daily soaps or in movies, whenever you strangulate somebody, your reflexes of your intestines, they develop. So when a person is fighting for air, is gasping for air, it is the sudden reflexes that increases your bowel motility and also causes your urine to pass. So when a person is struggling for life, for oxygen, it will pass stool, it will also pass urine. This is what happens with the baby. So we use this science that whenever the baby passes meconium inside the womb, that means it is not happy, it is not getting proper oxygen, either it is getting strangulated with the cord, or whatever reason, there is infection, there is high blood pressure, not good blood supply, all these reasons which cause low blood supply, low oxygen supply to the baby will cause the baby's intestinal reflex to develop, and then it will pass meconium. Now it can be natural as well. It is very natural for a baby to pass meconium when it is in a breech position. Breech babies, because their bums are down, they get the stimulus either through a gynecologist examining internally, or just while dilating, while in labor, the bums, they kind of touch down there and then they get the reflex. So a breech baby can pass meconium naturally, but otherwise in other conditions, if the baby is passing meconium, that is a sign of distress. The baby is not happy. Okay, now why is meconium aspiration so dangerous? What does it do? Well, meconium, as I said, it is a very thickish greenish colored liquid. So if the baby kind of drinks that, it can cause mechanical obstruction in the airway. It can cause a plug which is formed in the airways, and that plug does not let the baby exchange oxygen and carbon dioxide. When the baby comes out, this particular area is blocked. So how can it breathe? Okay, so this is called mechanical obstruction. It can also cause chemical irritation because it has so many things which the trachea, the bronchus, the respiratory system doesn't want. Lanugo, vernix, bile and all that. So they irritate the lungs. This irritation can cause infection, and this can also depress the surfactant formation of the lungs. Surfactant is a kind of enzyme or a hormone, you can say, which is produced, a chemical which is produced by the lungs, which helps the lungs to expand. Now when the babies are preterm, I have already discussed in my video on preterm babies, when the babies are preterm less than 34 weeks, they need some support therapy. When they are inside the womb, inside the uterus, we give the patient some betnisol, beclomethasone, that is a steroid injections, so that the lungs can produce surfactant. Once the baby is out, if we think that the baby is not producing enough surfactant for the lungs to expand, then there are injections, there are some oral therapies which we directly insert into the lungs, and this surfactant helps in expanding the lungs. So this particular surfactant which is produced by the lungs is depressed by the meconium. So meconium is causing double problem: mechanical obstruction, chemical obstruction, right? So because of this, the babies, when they are born, they have enormous respiratory distress, and depending upon how much meconium they have had, depending upon their own condition, their gestational age, generally speaking, gestational age seen in meconium aspiration syndromes is always above 37 weeks. Generally speaking, it is always at term, between 37 to 42 weeks. So it can be more serious in a post-term baby, a baby who is already post-mature, a baby who has already suffered from infection inside the uterus, a baby who already had some low blood supply because of post-maturity, because of placental insufficiency. So it all depends upon how much the baby has had the meconium inside, what is the general condition of the baby. These all factors will decide how we manage the baby. Okay, now we have discussed the causes. We have discussed the things that meconium does, the disadvantages of drinking meconium. Now coming to the signs, the symptoms and the investigations. How will we know, you and a doctor, how will we know that the baby has passed meconium? Well, the mother has to be the first person who comes to know. If at all she sees some greenish liquid passing through the vagina, she should immediately come to the doctor. Second thing is, if she is vigilant, she will feel that there is something wrong. Either the baby is not moving at all, very sluggish movement, or the baby is excessively moving, the baby is crying, gasping for air. So these are the two things which only the lady can decide, and she has to come running to the hospital, whether it's 2 a.m. at night, 4 a.m. in the morning. You have to come and get yourself checked. Okay. Secondly, the doctors. Now, if the doctor is suspicious, first of all, if the mother is post mature, she's already crossed 40 weeks, the first thing the doctor would do is a color Doppler. Or if she's getting induced for labor, the first thing that I would do is rupture the membranes. Rupture the membranes and check that there is no meconium, and then you proceed. Color Doppler will sometimes show flakes, thin flakes or thick flakes of meconium inside the amniotic fluid. So if the doctor is good enough to detect that, it can see that it is not a normal amniotic fluid. It is not the thin fluid. There is something wrong. There is some haziness, some flakes are there. So this is again a diagnostic thing for meconium. Third is CTG, that is cardiotocography. That is a non-stress test, and we have already had a separate video on CTG. It is a kind of ECG that we do when the baby is inside the womb. So we get that graph, and that graph shows that the baby is either not active, it is having a straight line, not a very good acceleration line. So it shows that the baby is not well, not happy, or it might show dips in the fetal heart, decelerations. So these are few tests which we can do, which make us kind of suspicious, but they are not 100% diagnostic. 100% diagnostic of meconium is when you see fluid coming out. That is the best way to diagnose, right? So these are certain things which indicate that we have to take some action. Now, what all investigations we can do? Well, investigations: CTG, color Doppler, ultrasound, physical examination, rupture the membranes, and once the baby is born, then you know that there is some respiratory distress, and to diagnose that it was meconium, definitely you can see it, but otherwise the chest x-ray is very helpful. Chest x-ray, in the chest x-ray we can see how much meconium the baby has actually inhaled, has actually gone inside the lungs, because you can see those thin lines, the strands, which are clearly seen in the x-ray. Now, how do we manage such patients? Well, such patients obviously will be in the high risk category, but not all patients undergo cesarean. It depends what gestational age you are in, what stage of labor you are in. If the doctor feels that the baby is about to deliver and the meconium is not that dark, it is not that thick, and it is a very yellowish kind of meconium, and probably it is an old meconium which baby is, even if it is inhaling, even if it is drinking that meconium, it will not affect the baby. Moreover, if we feel that the CTG that is running at that time, it is absolutely fine. So there are certain conditions in which we can allow the baby to deliver normally. We can help the mother to deliver quickly by using forceps or ventouse. Now it all depends what dilatation of the cervix is at the time. Now, if at all there is improper dilatation, we think that the delivery is going to happen after maybe half an hour, it is going to be more than half an hour, and the baby is not happy, and there is superseded infection, the CTG is showing decelerations. In that case, it has to be an emergency cesarean section, right? So if at all this happens to you, next time you will at least know, you will know why the doctor did an emergency cesarean section, why suddenly things happened, why suddenly things changed, because this is not in doctor's hands. Okay, now once the baby is out, what do we do? Well, we hand over the baby to the pediatrician, and the pediatrician will assess the baby. Apgar scores are there to see how the baby is at that time, whether the baby is active, it is moving its legs and hands, it is breathing, having a heartbeat, a good heart, or the baby is absolutely limp. So as I said, we'll do suctioning, we'll put a pipe, we might put a tube, we might give the baby some oxygen through ventimas, or such babies sometimes even land up in on a ventilator. It depends what was the condition of the baby. They are born with respiratory distress signs like grunting sounds, and they're limp, they're not very active, the color of the body is more of bluish than pinkish, and once we start giving them oxygen, if it is not changing its color, if it is not showing good respiration, they are still grunting, that means they need a lot of ventilation support, they need ventilator, they need a pipe deep inside, they have inhaled a lot of meconium. Okay, so that is something which decides the baby's condition later on. Now, as I said, to prevent meconium aspiration syndrome, it is very important to be vigilant for the lady who is pregnant. So you just be vigilant if at all you see all these things, because now you know what all things can happen. Then you have to go to your doctor running and tell them that please check my baby. Generally this will happen only in the 9th month, towards the end of 9th month. Now for the doctors, as I said, we do as the condition arrives, as the gestation and the dilatation and the baby's condition tells us, we discuss it and we do it immediately. Sometimes we just have to take immediate action. Okay, now there were certain things which were done initially, but I don't think many people are using it now. That is called amnio infusion. I have already discussed this in my previous video on oligohydramnios, that when the fluid is less, we kind of infuse some fluid inside the uterus. But in meconium aspiration, it is not of much use, because what we are doing is we are just replacing that meconium fluid with a normal fluid, but the baby is about to be born, because generally this happens towards the end of the 9th month. So it is not of much use, right? So please be vigilant, obey your doctor, listen to your doctor, keep yourself well informed, and what else, just take care of yourself. Now if I tell you about the long-term implications of meconium, generally such babies are born absolutely healthy, and if at all they are out of the NICU within 2-3 days and the respiration comes back within a couple of minutes, then the brain is not damaged and they lived a healthy life. Probably they might have some lung infection or some breathing problems for a couple of months, and that subsides. But in cases of severe meconium aspiration syndromes, such patients can have chronic lung diseases. They can be having some brain problems, some mental retardation, cerebral palsy symptoms, because there were loss of oxygen, lack of oxygen for a long time. They might even develop a hearing loss. So these are certain things which we do not want. I just hope nobody suffers from such conditions, but these are the things which you should know that can happen if at all it is a very severe case. So take care, guys. Please be careful about yourself, live a healthy life and be vigilant. Do not try to have home deliveries without the presence of any trained midwife. Okay, so take care. If you like my video, please share, please subscribe, and please hit the like button, and also click the bell button. Thank you very much. Bye bye.